Preparation for lumbar traction. We are going to apply the pelvic belt directly on the skin of the patient. The upper limit of the pelvic belt should be positioned at the lower limit of the target region. So we're having them right here. Okay, come back to the front. The top support belt here should likely cup right over the top of the iliac crest. So the iliac crest is here. We will continue to tighten this in supine. The thoracic support belt should be placed at the upper limits of the target region. Let's turn it on. And should cup the bottom of the rib cage. Before the patient lays on the table, ensure that the table is locked and ensure that the split in the table is also secure. Now I'm going to have you lay down. This area, the target region, we want it to lay right over the split in the table right here. Okay, so go ahead. Perfect. And now we are going to attach the support belts to the table. With the patient now comfortably on the table, connect the support straps to the table. With the patient comfortable in supine, we are going to secure the belt. You okay there? Mm-hmm. Let me know if it gets too tight. Okay. It's okay for the belts to overlap slightly. We can tighten it up. The target region is over the split of the table. I'm going to ensure that the table is unlocked. Okay. Now we're going to secure the traction strap. And double check that the support belts are firmly supporting the patient and stabilizing the patient. We'll have the patient set up in a 90-90 position, a position of comfort. The traction belt is now secure and free to move, and we are going to now connect the traction belt to the traction unit. All right, I'm going to connect the unit to the traction belt. And now I'm going to set up the unit for joint distraction. Patrick, how heavy are you?
About 180.
About 180. And so the setting for the max traction force is going to be 50% of body weight. That should be 90 pounds. We've set the maximum force at 50% of the patient's body weight for joint distraction and the minimum force at 50% of that maximum force. So with Patrick weighing 180 pounds, we have set the max at 90 pounds and the minimum force or the rest force at 45 pounds. We've now set up his maximum traction force and his minimum traction force. The hold and release times are 15 seconds on, 15 seconds off, and we're going to do this treatment for 25 to 30 minutes. Okay, I'm going to gently start the unit. You have a bell here to let me know at any point if you get uncomfortable, as well as an automatic emergency release that will stop the unit at any point. Okay, so you can take that. Please let me know at any time if there's any discomfort. If you feel like there's a need for a little bit more traction or a little less traction, we should not at this point in time feel complete relief of any of your symptoms. It should just perhaps feel better.
Okay.
The traction machine is slowly taking up the slack. You can see the separation in the table here. After the treatment is complete, we check in with the patient. How are you feeling right now?
Good.
How is your back pain on a scale of 0 to 10?
About a 1 out of 10.
1 out of 10, okay, good. And allow them just to relax. The machine is now off. There's no pressure through the system. We're allowing the patients just to acclimate. Now that the patient is unhooked from the traction unit, we will just relax the support belts. How are you feeling right now? Good. Okay. I'm going to help you come up to sitting. And before you stand up, I just want you to catch your breath, relax for a second, and make sure that you're not dizzy.
Okay.
Okay. In some instances, prone position traction is ideal for the patient, particularly those who are flexion sensitive. So the patient is positioned nicely in prone. Again, the belts are set up in the same way. We're going to have the pelvic belt over the iliac crest with a top portion or top margin of the support belt right at the inferior margin of the target region. We do the same thing with the thoracic support belt. Again, capturing the bottom portion of his rib cage. It's okay for the belts to overlap. And the target region is right over the split of the table. With the patient now set up comfortably and connected to the traction unit, the appropriate parameters can be applied for lumbar traction in prone.